This is Jerry Hesch, physical therapist at Hesch Institute in Aurora, Colorado. And if you go on Google and you type in side bent tailbone or side bent coccyx, you'll be taken to my videos. There's very little out there on side bent tailbone. There are a couple of women's health PTs, one in the Netherlands. Her last name is Rost, and she presented at an international conference on treating the side bent tailbone. But otherwise, there's very little, and there's very little in the literature. I do have an x-ray of a patient in which it shows the coccyx side bent. It was a very special x-ray. They're not usually taken in that angle of the body. They're usually taken sideways, but this was a front view of the tailbone. Anyway, I'm very fascinated by side bent tailbone, particularly because most people respond very quickly. It's usually a one-time treatment. I had a kid that could not play softball for 6 weeks, and it took one treatment. That night he went back to baseball practice, and he's done fine ever since. So there's little known about it, and it responds so very well to treatment. I push on it for 3 minutes, and then I pull on the ligaments on the other side. And for reasons I don't know, if people have that pattern, it's usually to the left, but I did see one person this year that had it to the right. So my patient Gwen is going to describe her very dramatic, very fascinating case of her side bent tailbone. So it's all yours.
Okay, so I found Jerry on YouTube, so I gave him a call, and he said he would see me. My physical therapist also came with me. He said I had a side bent tailbone. He corrected it yesterday. I'm back today, feeling really good. How I ended up with this, I had a sciatic thing going on my right leg. So I went to see a chiropractor, and it was pretty bad. I ended up having to go to an ER and get some x-rays and bring them back to him and stuff, and it kept going on. It was horrible. I was like screaming and dragging my leg. I had to have somebody help get me into the hospital off the street. And so he gave me an adjustment. He put a wedge underneath my tailbone, and it was just like a switch went off. The pain was instantly gone. So I would run around doing my thing. And he was going to be out of town, so he told me to use another guy. I did that. He put a wedge real high on my right hip. It hurt really bad. Got home, it kept getting worse. So I went to the ER, got sent home, said it was sciatica, I believe is what they said. And so I thought, well, okay, worked before. My guy's back in town, I'll go back to him. Did that, and something went terribly wrong. I was bawling when I walked out of there, had to go to the emergency room. And it just started a chain reaction of emergency rooms, urgent cares, doctors, pain management, injections. Everybody just kind of treated me like I was a seeker. And
A drug seeker.
Yeah, a drug seeker. And I had no clue about opioids at the time because I've never taken them. So I had no clue about this issue going on. I was just in pain. And I've got my poor little granddaughter dragging her with me wherever I go, you know.
And you said that at the hospital you had to you were on all fours because you couldn't tolerate standing and you couldn't tolerate sitting.
Several times. Yeah, couldn't stand it. My pain management doctor actually called an ambulance for me from pain management.
Wow. And you told him that it was your tailbone.
Uh-huh.
And you felt like you were ignored?
Well, yeah, because I told everybody it's beside my tailbone. Like a joint beside my tailbone. And, I mean, we got tons of MRIs, x-rays. Nobody ever physically inspected my tailbone.
Okay.
And so I got some injections in Texas in the wrong spot. I got injections in Oklahoma, and that worked well for a few weeks. And then the pain got out of control once I got out here to Colorado. And they put me, at the emergency room, they put me in touch with healthcare. And I got to New Health Pain Management.
Okay.
And they helped me a lot. They got me to, Becky is my 4th physical therapist through their company. They tried different ones on me. And she, a couple of weeks ago, she started working on my tailbone internally.
Uh-huh.
And last week it was really bad shape because it hurt so bad after I left there. I was down. it was terrible pain, and it started feeling better, but I'm still in pain all the time. And I had looked you, or I didn't look you up. I saw you on YouTube, so I discussed it with my doctor last week, and he said that might be a good idea, or maybe a chiropractor if my physical therapist knew of someone that was good. So I saw Becky, and then I had called you the day before, and you told me to come on over. So here we are.
Yeah, so you were ultimately diagnosed by the fourth physical therapist you saw.
Let's see, how many have I had? Yeah, 4.
Okay,
Becky.
and she's a pelvic floor physical therapist.
Yes, she is.
Yeah, yeah. And then interesting story, because she knew of me. She had my workbook.
Oh yeah, she was really excited. So
Yeah.
she came with me yesterday.
She graduated from University of Indianapolis, and one of her professors there gave her a copy of my workbook from a long time ago on the SI joint. There was nothing on the coccyx in that workbook.
Yeah, 'cause I told her who you were, and she just pulled the book out. She goes, "That's him."
Yeah. So small world. I got to behave wherever I go because it's a small world. But so you came in with a 9 out of 10. And am I correct that you did not sit yesterday? Did you sit on the sofa yesterday?
I did, but on this cushion.
You sat on your coccyx cushion.
Yeah, I haven't tried to sit without it yet.
Okay, alrighty. So you were a 9 out of 10, and you walked slowly. Your pelvis was shifted over to the right, and moving, getting on and off the table was painful.
Yep.
Then I found that you did have a side bent coccyx, as far as I could tell with my eyes and hands, and treated it, and then you got up really quickly off the table. And so your pain decreased by how much yesterday?
Quite a bit. I know I was smiling when I left here.
You smiled?
It was a lot because I get off the table really easy, and it's really hard for me to get on and off the table normally.
Yes, yeah. And then today you woke up, and how did you feel?
Okay. I didn't have the stabbing pains. Just really stiff today. Some nerve pain feelings, but nothing like I've had.
Yeah. And so I found tightness in your hip rotators on both sides.
Okay.
And we just treated that. And then how do you feel now when you walk?
Better. Still a little stiff, but better.
Yeah. And those muscles are very near that area.
Yeah.
You know, your piriformis muscle is so close to that tailbone, it comes off the sacrum as well. So we're addressing that. And I'm going to turn your care back over to Becky, the pelvic floor PT. Your tailbone is not going to need me to treat it again. It's going to stay put.
Thank goodness.
Yeah. So any final comments?
No. Thank goodness I found you. It's been horrible. It's been awful. This happened in 2018.
2018. What month?
November.
Wow. Total of how many doctors do you think you've seen?
I don't have a clue.
9 ER visits or more than 9?
Probably. I've had more than 9 ER visits.
Sorry?
I've had more than that.
More than that. In 1 month you went 9 times?
I'm pretty sure I went 9 times in a month.
Yeah. And anyway, I'm so glad you're better. We'll stop here and thank you very much.
Thank you so much.
So do you think side bending tailbone is important?
Yeah, I do.
Yeah, I do
Yes.
too. Thanks.